Hi, this is Katrina Osei, and I am doing my video presentation on my quality and safety topic for medication errors and dispensing systems. um, I wanted to talk about this because it hits home for me. I've ran across this issue in a couple of settings and facilities I've worked in, not just one place, but a couple. And it's centered around the one issue, and it's medication administration and that process, as well as the prevention of medical errors. In the facilities I worked in, we used medication dispensing systems called Pyxis or Omnicell, and this is an integrated part of the medication administration process. We used an EMR application, be it Cerner or Epic, that spoke to the medication dispensing system and gave the orders over to them, and then we would pull that order and the medication from the Pyxis machine. Well, the breakdown came where the facility's pharmacy is responsible for loading that machine when the medication runs out. And sometimes there is an issue with the proper medication being put into the right slot. That seems to be a weak point in the medication administration process because the nurse is counting on the proper medication to be loaded according to what it says on the screen and the order. So when they go to pull it from that slot, if they are distracted or whatever, they end up pulling the wrong medication, and hopefully they don't notice that until they get to the patient's bedside. The safety issue with this is that the wrong medication could be inadvertently given to the patient. So the initiatives to resolve this issue with the weak link in the medication administration process would be to, of course, do your core nursing and prevent medication errors by following the proper steps of administering medication, like the 5 rights, and verifying that the correct medication has been pulled from the medication dispensing machine at the point of contact. So when you're in the medication room, hopefully it's a quiet place, you're not distracted, no one's trying to get your attention, and you're able to focus on and read the name and the dose of the medication you're pulling from the slot each time you pull open a drawer. Another initiative would be to provide patient medication education, letting the patient know or make sure that they know their medication and what they should be taking and what they're taking it for. A lot of times if you take the wrong thing to the patient's bedside, they can tell you, I don't take that and I don't know what that's for. Either they'll ask you to explain it to them, or they'll say that may not be right. Could you please double check? Another thing is to bring attention to the problem when you come across it. So to prevent them from happening again, you have to make sure that attention is called to the situation so that it can be readily resolved. If we don't know where the breakdown is at, then we cannot address the issue, and then that just puts more people at risk in the future. So this will require a collaborative initiative between both the nursing department and the pharmacy department to come together and troubleshoot ways that we can streamline each and every step of the medication administration process, including the pharmacy technician's job of loading the right medication into the right slot in the medication dispensing machine. So a major contributing factor to administering medication safely is infrastructure in dispensing and verifying the medication. So like I mentioned earlier, a lot of places have the workspace designed where pulling the medication and preparing the medication is done in a room that's enclosed, so the nurses have a quiet place to prepare and pull their medication for the patient. This is good because it allows them to have full focus and concentration on what is being pulled and how they're preparing it and making sure that they're not going to administer the wrong thing. Nurses, too, are more vulnerable when they are scanning meds at the patient's bedside, so we can't just depend on that to be our stopgap safety point. We need to do it through the whole entire medication administration process. They are most vulnerable at the bedside, nurses are, in this medication administration process because they are in direct presence of the patient. the family, and then coworkers always seem to come in and chime in when you're in the middle of medication administration. So chances are your concentration may be broken during this process. It happens to the best of us when we're busy or on a busy unit, or we have a patient with a lot of questions or family with a lot of questions and concerns. You don't want to put them off and not answer their questions, but at the same time, you're distracted from administering that medication. So more the reason why that safety process needs to be done through the whole administration process, including being able to pull the right thing from the machine every time you go there. So I have one real-time example. Actually, I just pulled this from my email at one of the places I'm working, and it's talking about this very thing. There was some confusion about the medication dispensing system, and this was the email that was sent to us. It says, in following up from today's patient safety event reported this morning with medication dispensing, be aware that Omnicell has the ability to offer a substitution or equivalent medication in place of a medication that may not be loaded or readily available. The nurse will need to then actively accept or refuse the equivalent medication. Be advised a different concentration may be offered. Attaches a reference for your review for your unit needs. Thank you, and so on. So here is another example. I mean, this is frustrating because if you didn't read this and if you didn't know that was a possibility, this was an attempt to communicate this, but you could get the wrong kind of concentration or the wrong, or think that you got the wrong thing where really an equivalent was put there in place. So it's really trying some with these medication dispensing machines and working with what pharmacy has available and making sure that you're dosing correctly with whatever concentration they have in there, and so forth. There needs to be a collaborative, ongoing initiative between the two to come together and make sure that all these things are communicated, that everything is on the same page, that everyone understands what they're supposed to be doing, what they're supposed to be pulling, so there's no confusion for the medication and what should be given and everything. So that is really what I have for you. That is my safety and quality point. And it's been a very good journey going through this and seeing all of the evidence-based data and doing the literature review on it. It's been very insightful. So do I plan to take this to my nursing leadership? Yes, there has been discussion about it. I have filled out the risk management forms at the point of contact when these things have come up. I've also called pharmacy and brought it directly to their attention and kind of stayed on to make sure that these things were addressed before the end of my shift, because I am very adamant and I feel very passionately about pulling the wrong medication out of the machine. It just bothers me so. So I have talked to, the different departments. I have worked up the chain of command on this. I do every time. Here with this, as you can see, our quality and safety team are trying very hard to streamline this process, work with pharmacy as far as availability and what they substitute for, and they're trying to communicate that. But when we get into that, it gets confusing. It's highly concerning because what we might do one day, we're not going to do another day. And when you have, a medication that's put into the slot that's nowhere near what you should be pulling, that's really a cause for concern. So we have an ongoing conversation about that. I just want to emphasize the importance of reporting these adverse events and not worry about being retaliated against, because the bottom line is patient safety. We have to take action and do what's going to be in the best interest of the patient, maintain that quality and maintain safety in the care for our patients. I know a lot of people feel like they would be reprimanded if they report a near miss or even an adverse error or whatnot, but it's best to let everyone know and let the physician know, so that if there's something that needs to be done to counteract anything, or ensure that the patient is going to be okay through it, and then that's what comes first at that point. So I learned a lot. I learned a lot in all of this, and this has been a very good project. And so a lot of data is coming out on it, and I look forward to just kind of watching and see how this goes. All right. Thank you. Have a good day.